The clinic that we're running here at UFS Medical is an osteoarthritis dedicated nurse-led clinic. So I'm working closely with our GPs and our allied health team to support those patients with pain and osteoarthritis. The advantages of having a nurse-led clinic are really for the patient. So, you know, the access to allied health, access to a nurse who's passionate about what they've come to see the nurse for, so for their osteoarthritis. And the fact that our patients are able to see the same nurse each time. My scope of practice and skill set has improved dramatically. It's a real value to the practice having a nurse that can spend the time dedicated with the patient, and we all work together as a big team really here. From being involved in the nurse-led clinics, I've found personally that it's been lovely to be able to tailor a care plan to the patient's needs, so for their osteoarthritis. And through doing this, our GPs at the practice have also been quite confident in referring their patients to me that have osteoarthritis. So that's quite a value to the practice as well.
The Osteoarthritis Project has given patients the access, support and skills of a practice nurse dedicated in the area of osteoarthritis, and it's had quite an impact on the patients themselves. They've been able to speak to somebody in a fairly long amount of consultation time about their condition and how they can be best supported by the practice nurse. We found that it's certainly improved patient flow. The more that they're coming in, the more benefit they're getting out of the nurse-led osteoarthritis clinic. They have the same contact with the same nurse throughout the project, so they know who they'll be seeing, they develop a rapport with that person and they're more likely to come in for their appointments.
I feel that the nurse gives a different perspective to their healthcare and also helps free up the GP's time, but also the nurse helps the patient in the whole breadth of healthcare. We just don't want the situation to be dismissed as just arthritis, because these patients are living in pain and discomfort every day, and the nurse is perhaps able to outline some measures that the patient could take that the doctor has not addressed. One of the advantages of nurse-led clinics is that between the doctor and the nurse and allied health, you can share the care in high-risk patients. I think it particularly has enabled the patients to become more involved, and the patients are taking control of their illness and taking a more positive attitude, and that definitely helps us as doctors.
The advice I'd have for practices looking to establish a nurse-led clinic is really to find GPs and nursing staff that are passionate. I think from passion everything folds out from there, and you'll have a really successful project and nurse-led clinic and really good patient compliance and patient outcomes.
For nurses in primary healthcare that are looking at setting up nurse clinics, I think it's important to gain the support of your peers. So to have that support from your practice manager and the management team, as well as your GPs and allied health professionals. But I think if you've got the support and people that are happy to help drive the project with you, then it's quite successful.